accompagné de la ministre de la Santé et des Services sociaux, Mme Danielle Mécan, et du directeur national de santé publique, Dr Horacio Arruda. Monsieur le Premier ministre.
Oui, bonjour tout le monde. Avant de vous parler du bilan quotidien, je veux revenir un peu sur les résultats de façon générale et puis sur la raison pourquoi on fait tous les efforts, pourquoi on demande tous les efforts aux Québécois. D'abord, je le rappelle, ça a l'air simple, mais on a un virus donc, qui se transmet d'une personne à une autre personne. Donc, c'est assez simple. Ce qu'on veut, c'est d'avoir le moins de gens possible qui aient des contacts. Donc, c'est pour ça qu'on a été un des premiers États en Amérique du Nord à interdire les rassemblements, ensuite à fermer les écoles, ensuite à fermer toutes les entreprises et les commerces.
And stores that are not essential in our life in the next few weeks. So there are people who are looking at the number of cases that are increasing and they're thinking, well, are measures working or not? First of all, we have to be prudent when we look at the number of cases. We have to look, of course, at how many tests we have. I've said it before, all proportions taken into account, we've tested quite a bit, and we've also tested certain people. It's not everybody who has chosen to test, for example, in the first weeks, all those people who had symptoms and who had traveled, both. So we tested the people who were more at risk, so it's normal that we have more cases. Our success or failure will depend on the number of deaths. When we look, for example, in Europe, we can see, if we look per 1 million inhabitants, there are countries that have a lot of deaths, for example, Italy, Spain. And at the other extreme, we have countries that had fewer deaths, particularly Germany, where there were very few deaths per million inhabitants. In the middle, there's United Kingdom and France that are in between the two. So we, of course, are going to try to get closer to the measures and results as much as possible of what has happened in Germany. And if we look at what has happened up until now, because we had to compare ourselves mainly with North America, we have fewer deaths by quite a bit here than in the United States, from the simple to the double per million inhabitants. So that means that our measures are functioning. You'll see today there's an adjustment on the number of deaths, but even if we take that adjustment into account, we can see that we have fewer deaths than the United States by quite a bit margin. It's not fair to compare with Europe because Europe started before we did, but it remains that we have way fewer deaths per 1 million inhabitants than they do in the United States. So that means that for the time being, the results, what we want is to minimize the number of deaths, and it's working. It really is. But we have to continue, and continue, and continue. So we have to continue with keeping the 2-meter distance for the older people who understand feet better, so 6 feet, never being less than 6 feet away from people, and even better, all those who can remain at home will stay at home. That is what is the most efficient in order not to catch it. So, the numbers of the day. First, as I was telling you, there were about 20 cases that were being investigated for the past week to know whether the people had died of COVID-19 or not. So this is going to bias the results somewhat. So today we have 25 deaths, extra deaths, but the vast majority are not deaths of the past 24 hours. So we have to look at the total, which is 61 deaths in Quebec. And of course, I offer my condolences to all the families of the people who died. If we look at the number of confirmed cases, we are at 6,101 confirmed cases, an increase of 583. 429 people who are hospitalized, an increase of 64, of which In these 429, 122 are in intensive care. So that means that, of course, they are more serious. That is an increase of 26. I want to tell you that we're working really hard right now, the scientists of public health, amongst others, in order to present you with projections. So to be able to tell you here, according to different scenarios, are going to be the results that we are anticipating in the next weeks and the next months. We are targeting to give you a presentation about this on Tuesday. So there are meetings that will take place over the weekend in order to finalize all of this. But what I want to say is these are scientists who are preparing this together with Dr. Arruda. A word on medical equipment. So the masks, the gloves, the gowns in particular. We had a long telephone conversation last evening, all the premiers together with the Prime Minister of Canada. And many, myself included, we wish to modify the breakdown of the orders that are received by the federal government. What we want to do is that up until now we've had a sharing that was in percentage of the population. However, we can see that in the big cities, such as Montreal or Toronto, if we look at it proportionally, there are more cases than in further away regions. So I think that it would be normal that for the bigger cities such as Montreal and Toronto, where there are more cases, that we have more medical equipment be transferred from the federal government to be able to respond to the need of the population correctly. In the meantime, the government of Quebec, of course, we have continued together with the Minister of Health to make every effort possible to go get additional medical equipment. We have a small improvement. We were at 7 days of equipment, and now we are at 8 days worth. So we have an extra day. It's not much, but still, we now have for 8 days worth of medical equipment. Now, a word for small businesses. This morning, the Minister of Economy, Pierre Fitzgibbon, announced a program, local funds, that are going to be distributed everywhere in Quebec for small businesses. It's important we made the choice, rather than managing that directly in Quebec City, we chose to decentralize these funds. So it is the municipalities and the regions, what we call the MRCs, that are going to be managing those funds. And it is those people regionally who best know what the small businesses are in those regions. So they're the ones that are the best placed to know who to help amongst those companies. So these funds in total are of $150 million. Now, my daily thanks. We're talking a lot about a guardian angel, rightly so, but we also have a lot of people who are giving essential services who are not always very well paid. I'm thinking, amongst others, cashiers in supermarkets, in the depths, in pharmacies. I'm thinking of all those people who do deliveries. We had told you that we were looking at financially helping those people, because we do have to take into account the fact that the federal government is offering $2,000 per month to the people who have lost their jobs. It could be perceived as being unfair that people make less than $2,000 per month while still working in essential services. So the Minister of Finance, as well as the Labour Minister, Éric Girard, Jean Boulet, are going to announce a program this afternoon. So what we're proposing, generally speaking, is to increase the wages of those people by $400 a month for 4 months. So $1,600 per person for those workers whom I thank from the bottom of my heart for the work that you're doing in conditions that are difficult. And we're also doing this concrete gesture. I also wish to tell you that in the measures that were announced yesterday, which didn't include all the nurses, auxiliary nursing of the private sector, we're looking at all of that. So we should quickly be able to correct things and announce good news. So I would like to end with my 3 priorities. Don't go out unless it's necessary. If you do go out, stay less than 6 feet or 2 meters away from other people. When you come back home, you wash your hands with soap for 20 seconds. If everybody continues making the necessary efforts, I think we will continue having better results than others. And you'll see it in our projections next week. There are hundreds of lives, even thousands of lives, that depend on us respecting the guidelines or not. So it's really important to follow the guidelines that we give you because there are lives at stake. Thank you.
All the efforts we're doing in our fight against the virus are working. We're expecting to see an increase in the number of cases, but we are saving lives right now. I know that the battle is tough for a lot of people on the economic front. So that's why we announced this morning a new financial aid to small businesses that will be managed by all the different regions. We will also announce this afternoon a compensation for people who earn less than $2,000 a month, the famous $2,000 a month offered by Ottawa. So I repeat our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances, 6 feet, 2 meters. And when you come back home, wash your hands. That's how we'll save hundreds of lives. Thank you all. Et je veux vous annoncer aussi.
And I also wish to announce to you that to stay in good shape, I will take the day off tomorrow, so it'll be the Deputy Premier, Geneviève Guilbeault, who will be here for me tomorrow, and I'll get back to you on Sunday. Thank you, Mr. Premier. So for the question period, we're going to start today with Gabriel Bellin. Yes, hello to all 3 of you. We learned this morning that the company 3M, Washington asked them to stop exporting their N95 masks to Canada, amongst others. Could this have an impact in Quebec? For example, is this a supplier of masks in Quebec? Right now, we're taking into account those realities. So what is going on, for example, in the United States? We think that we are tight, but that we can get through with orders coming from elsewhere than the United States. But of course, we would like to continue receiving orders from the United States, but we have to be realistic. We talked about that in the past few days. It's going to be a hard war. The countries that manufacture equipment are going to want to keep them for their own citizens. And that is why one of the things that we talked about yesterday with the different premiers is that as quickly as possible, Quebec and Canada, and I'm thinking specifically here of Quebec and Ontario, we have to be autonomous. We have to be able to manufacture our own gloves, gowns, and masks. So, of course, we have companies in Quebec and in Ontario working on that, and I am optimistic that in the next few months we'll be able to get there because we do have to be realistic. It may be difficult to continue receiving orders from the United States, and we were taken short. From what you know right now, do you think that a mask that performs as well as that one with COVID-19, could we produce that in Quebec? Can we manufacture it? Yes, we can. Between Quebec and Ontario, we believe that we are fully able to manufacture N95 masks as well as procedural masks, the surgical masks. So we believe that it's possible. Now, how long is it going to take? That's what we're working on right now with other people. Same thing on the Ontario side with Doug Ford. We talk a lot and we speak about it together. Ontario made its projections public in the past few minutes. I'm giving you a few numbers. 3,000 to 15,000 deaths are predicted over the next 18 months. Doug Ford said without measures they would have had 6,000 deaths in April. with the measures that were taken in Ontario, we're thinking about 1,600 deaths in April. I know that your projections are going to be giving them to us on Tuesday, but are we going to have that much transparency from your government? Is that what it's going to look like, those numbers in Quebec? Well, we will give you those numbers, amongst others, the number of predicted deaths in the next months. Of course, as Mr. Ford said, so it's not an exact science, so it's more a range. So that is what we'll be giving you on Tuesday. So yes, we'll be very transparent. I wish to give all the information that we have, but at the same time, we have to be able to tell the people that there isn't one specific number. And we also have to say so, depending on how much we respect the guidelines, that will change the death toll. And, right now we have more measures in Ontario. We have more businesses that are closed. The construction sites are closed. So I think that, yes, it's a decision that is hurting the economy, but it is a decision that is going to save lives. I'd like to talk about the shortage of equipment in doctors. It's our investigations that reveal that after the masks, they think that there may be a lack of medication. There's an internal note that circulated in the past few days saying that probably in link with the pandemic, many different medication are out of stock. 40% of the medication could be affected. Is this a concern for you? Yes, but what has to be said right off the bat is that right now we have what we need to be able to treat our patients. So that is clear that right now we have the medication that we need. But there is a world need for that medication, propofol, for example, and other medicine for sedation when, somebody goes through surgery. So we have to be very rigorous in the use of that medicine. But we also should tell you that we're having a lot of discussions right now with our suppliers, our pharmaceutical industry, and we are going to continue working very hard to continue having the availability of that medication. I'd like to reiterate that we do have what we need right now for our patients. Are you thinking of adding Charlevoix to the regions where there's a ban on moving around? No? Have you heard about that? The analysis are ongoing. It's possible that it may be the case, but there's discussions right now being done, as I tell you, every day with different regions. And we are going to see, if ever we see that, there's an epidemiological reason to do this, to separate or to, when I say separate, I mean, to limit moving around, then we'll do it. Mr. Trudeau talked about the fact that there may be the army that will go to north, the Rangers, and we saw that there's floods that started in certain areas over the night. Police officers are running after people gathering, and there's roadblocks, and at some point there's probably going to be, more people who are going to get perhaps ill. I'm assuming that police services are going to be overwhelmed pretty quickly. Well, first of all, there is, it's the Rangers that are going to the north, and they're already there in the north. So, we think that it's a good idea to be able to use their own services during the crisis in the north. So that is why permission was asked. It's a division of the Canadian Armed Forces. So those people who are ready up north and who are helping, because the region over there really wants to isolate itself. And also separation has to be made in case the situation were to worsen. Now, concerning the floods, of course, we have already started seeing some of those in the both regions. So everything is under control right now. We do not believe that we will need the Canadian Army. But if at some point we believe that it would be useful to have the Canadian Army be deployed, we will ask for the Canadian Army to come.
Bonjour, Monsieur le Premier ministre, Madame Mécan, Monsieur Arruda. D'abord, sur les 25...
Out of the 25 new deaths, is it possible to have a breakdown in terms of age? Because what we've understood up until now is that it's mainly elderly people, almost exclusively even. Is it the same situation? It's still the case except for one exception. First, you have to understand that most of them are above 70 years of age, very concentrated, more in the 80 to 90 age group. But there is one person who was between 30 and 39 years of age who unfortunately also died in the Montreal region. This person had a morbidity associated. This person was overweight, which can bring increased risk. My other question, you partially answered this, but I wanted to know more in the long term. When you talked about autonomy in terms of equipment, we know that throughout the years we had an industry that was flourishing. The textile industry in Quebec, for example, during decades, and now we almost have no textile work here anymore. That is one example, but there's other sectors that are also affected. Is what is going on right now with the shortage of equipment that we have and all that, does that make you question yourself to know whether we shouldn't have a policy in the long term, not just, for this present situation, in order to try to have a self-sufficiency policy in terms of material and equipment that is as important as these? Yes, absolutely. I think that if there is one lesson that we're learning from the present crisis is that we should be autonomous for the goods that are essential. And the medical equipment, that is an essential good. You'll notice that we still have expertise in the textile sector, but the challenge is to have the fabric that protects. So it's more on that aspect that the issue is right now. But we believe that we'll be able to. Now, there's a question of time, but we believe we'll be able to get there. And if we look in the longer term, all the medical equipment, all the production that we need to be able to give care to the population, we're going to have to be autonomous. And I'm also thinking about, food stuff, fruit and vegetables. We know that in the winter, we depend a lot on the products that come from countries where it's warmer. So we want to be able to, with greenhouses, for example, and the fact that we have a cost of electricity that's very low, we want to be able to produce more locally and to be autonomous on the consumption side for our foods, because we can see it right now. Perhaps we wouldn't have thought that a month or two ago, but one of the essential services is to be able to feed the population, and that means that the entire food chain, from farmers to processing, we can see it right now. We've had a challenge that we are being faced with at the butchers and slaughterhouses. If we close them down for sanitary reasons, well, the animals that were supposed to be slaughtered are piling up, and that creates a huge problem for producers. So all of that, we're going to have to think about it. The entire food chain, making sure that if there were another crisis at some point in our collective lives, that we be able to be autonomous. So you're going to be offering temporary premiums for employees from the health network of $4 an hour extra for the attendants, and also you said that you were going to help people with low wages. There's still discussion going on with specialist doctors. There's a settlement project that was thinking that for the pandemic, there might be a lump sum that could bring them up to $1,900 per day. Is it necessary to increase the specialist wages to this extent? Well, maybe I can just start, and after that, Danielle will give more information. But the principle is that there's no question of increasing the specialist doctors. There's an annual sum given to them. But since we have deferred a lot of surgeries, well, there's also a part where they're paid by, the act that they have. There are specialists that are doing the work of family doctors. How do we pay them? But the principle is to say we respect the total amount for specialists, but we're going to try to find a formula for the new way. that we're doing things right now. Yeah, essentially, as a premier is saying, this is just a reorganization in terms of the remuneration, because there's a lot of activities that have been let aside, and those doctors are going to be reassigned. So we have to plan for the payments under different circumstances. And I would like to take advantage of this opportunity to say that there are doctors that are going to work in other sectors, not only in hospitals, but in CHSLDs, amongst others. We know that we need to have more interventions there. So that is the content, of course, of the agreement within the present total amount of those doctors, those specialists. Now, since you announced yesterday a new increase in the presence of police officers, you asked them to be less tolerant, to intervene more, and to distribute fines. There are readers that have written to us, and they're asking themselves all sorts of questions, because from one city to another, the rules are not being applied the same way. Some people are wondering, can I still go run? Can I still go play in a park? Could you give guidelines that would be clear and standardized for all of Quebec? Well, what we're saying is, yes, you can go jog, but you have to respect the 2-meter rule. So, and we're saying no gatherings. So people who get together, who are keeping 2 meters away from one another, is that a gathering? I admit that there's a question of judgment in that, but ideally is, it's better to err on the side of caution. So no gatherings of large groups of people, even if you respect the 2-meter rule. So, of course, there is a part of that is a question of judgment and all that, but somebody who intentionally does not wish to respect the guidelines, well, yes, we've already started giving fines.
Bonjour à vous. La question s'adresse à Dr. Arruda. Chaque jour,
Dr. Arruda, every day you talk about the number of confirmed cases of people who are infected, but since the screening targets a more specific clientele and that people can catch the virus without necessarily having it declared or pass tests where they're not symptomatic, the official number could be underestimated. What is your estimate, therefore, of the real number of cases in Quebec? Well, that's a good question that you're asking. It's always difficult to project. It's clear that we know, and it's the same thing with the flu or influenza. So the lab tests or the screening tests are never as high as a quantity of people. And that we'll know, I would say, a little later. Are we going to have 30% of the population that will be affected? 40%? 50%? 60%? Some people even say 70%. The lesser we have, the more chances we have of having a second wave. So it's difficult for me at this stage. I mean, it'll be easier when we get to the peak, maybe, to be able to tell you a little bit what the estimate that we have will be. But it's clear that it's an underestimation. And it is a case everywhere. First, because there are people who had no symptoms and who got cured, and we'll never count them. The more there are those people, the more it means that there will be mass immunity. And that means that the virus won't be able to repenetrate as much. But for each case, there might be 10 others. I can't say that. For each case, that's clear. There's 4 or others. No, we'll have a look at it in function of our own epidemiology, because we could look at it according to the epidemiology in Italy. It's not the same conditions, because don't forget that right now we've put very intense measures in place. And with those measures, the rate of infection per case decreases. Of course, I can tell you that the rate of increase of the population in Montreal is greater than that in the Gaspésie region, of course, because there wasn't as much circulation. But there are too many hypotheses so that scientifically I feel comfortable giving you any kind of number right now. You saw what happened yesterday in Montreal. Should we call out more specifically to the Jewish community of Montreal to make sure that they respect the ban on gatherings? The guidelines have to be respected by everyone. There are no exceptions for any community. So when we see social distancing, it's the same guideline for everyone. Yesterday, with the intervention of this SPVM in that synagogue, we understood what the procedure was in order to get to a fine. It seems to be a lot more complex than simply giving a $1,000 ticket to somebody. There's an entire process. You have to go to DPCP. Couldn't you decree, since you have the power, to say we're going to give, tickets more directly? We're not excluding anything right now, but we believe that the system, even if it's a bit slow, it does work. Of course, there can be contestations, and it's normal. People can say, well, that's false, what was seen. But I think that for the time being, we are satisfied with how things are working. Along the same lines, because of course you could eventually add more constraints in the usage of cell phones, for example. Could you use those to see people who are ill, for example, to make sure that they are not moving around? Where are you at with considering this possibility? The Sûreté du Québec is making an analysis to see whether we might use geolocalization, amongst others, via cell phones. But it is important to say it, for the time being, we have not used that method. And in the short term, we have no intention of using it. Now, if the situation were to be different in a week or two, would we accept the proposal of the Sûreté du Québec? Perhaps. But for the time being, we have no intention to do so.
A été envoyé par Marco Belair Cirino du Devoir. Outre des masques.
Apart from the masks, the gloves, and the protective gowns, what material, for example, medication, what material is the Canadian government trying to acquire to be able to get through this crisis right now? Well, there might be one item that you forgot in the list. It's the reagent to analyze the tests, to see whether people are positive or negative. But we're working on that. And I'm confident that we'll get to... It's kind of like a formula right now. So right now the formula is being tested in Winnipeg, and once it works, we'll be able to do the mix ourselves. And on the medication, as I was saying earlier on, we have a lot of links with our suppliers in the pharmaceutical industry, so it's going well. But I want to take this opportunity to thank pharmacists, the pharmacists at establishments, but also the pharmacists who are in community pharmacies for the medication in general, and as well for all clinical intervention that they render, because you will understand that that role is essential, that of our pharmacists right now. We know that they do a lot of interventions with the population at distance, remotely, in establishments, a lot of interventions as well. And these people are experts on medication and medicine, so they help us a lot in the management of medicine, which is very rigorous, and it benefits our entire population. So I want to take this opportunity to thank them for all their ongoing work. Now, concerning that projection that you are going to reveal to us, why only present the most probable scenario and not the optimistic and pessimistic scenarios? Dr. Arruda, do you fear demobilizing people or to make them too fearful by communicating too much information? Well, perhaps I could start answering the question. First of all, we're not excluding the possibility, in fact, of presenting more than just the one scenario. So it's probably what we will do, to present a few scenarios. And listen, first of all, I just want to tell you that before commenting anything whatsoever on what's been done elsewhere, I want to be able to have a scientific look at it. Even though I try to, try to explain information clearly, I want to take the time to understand things properly. And, giving, max and minimums and giving a whole range of it, of course, we would, without saying that our scenario would be the perfect one, we have to have a good analysis of what's happened elsewhere and of what is happening in Quebec as well, because very often people would like to be able to say, when is going to be the peak exactly. It's not going to be in the same day in Montreal as it will be in Gaspésie, for example. We're talking about all these elements, and it's not because there's a lack of transparency. It's just that by the time we get to giving you numbers, we want to make sure that they're as reliable as possible. Not reliable in the sense that, it's the truth, because it's only in hindsight that we'll be able to see whether it was correct or not. So it's not just a question of deciding things at the government level. Our scientists, before communicating anything, they want to have the right information, because we could tell you, it's going to be like the Spanish influenza, You know, it's kind of like this kind of scenario that you can see in terms of range, but we want to document things as much as possible. And already we've seen the impacts of our interventions, and it's just me alone. It's our scientists as well. We believe that when we communicate things to people, we have to have a certain level of certainty. Otherwise, if it's too much of a margin of error, it's too big, it doesn't help in terms of making a decision. And what is important, in my opinion, yes, the numbers, the scenarios, we use them to plan intensive care unit, the beds, the masks, and all that. But it's what we're doing right now. So as the Premier told you, on Tuesday, you will get more information, but information with which our scientists and myself, we want to be able to understand what all the limits and everything that has to do with it, and taking knowledge of what's going on elsewhere. Because sometimes we compare apples and tomatoes. Even though they're the same color, sometimes it's not always the same fruit. Thank you. This completes our French questions.
We'll switch in English with Cathy Sonnet from CBC News.
Good afternoon. I would like to basically follow up on this question. Ontario has come first with projections. The federal is supposed to do it at some point. What's the importance of you, Mr. Legault, to present projections to the population of Quebec?
I think we have to give the population the information we have. But until now, the information was not clear about the number of cases, the number of deaths that we forecast in the next months or even in the next weeks. So that's why we're trying to have more analysis of the situation. We have scientific people knowing very well how to analyze that are doing that right now. I've got a meeting this afternoon with them. So I want to be sure before giving any figures to the population that it's reliable.
Regarding Mrs. McCann, the Verdun Hospital in Montreal that is quite hit hard by the COVID-19, what about other hospitals in the province? And what's the plan if we start to see major spread of COVID-19 within the hospitals?
Well, the hospitals are prepared. We've been preparing for many weeks. As you know, we've mentioned that we freed almost 7,000 beds and 700 critical care beds. They are free, so to receive the population that would require it. And we've reorganized the hospitals in what we call cold zones and hot zones. So the people who have COVID-19, they are in the hot zones, and there's a staff, a team that is devoted to these patients. So the separation is very clear, very important in the hospitals. But again, situations like that can occur, and in Verdun Hospital, it's under control. They've isolated everybody that has been infected, and the staff that has been in contact are being tested, isolated, and tested. But of course, we want to take all the precautions, and the hospitals, they have all the protocols, take all the precautions to avoid these kinds of situations.
Next question, Samuel Pouliot, CTV News.
Hi. Mr. Legault, there's growing concern that the Sûreté du Québec plans to use cell GPS to enforce quarantine. If this happens, how can you ensure Quebecers that their privacy rights will be respected?
Okay. It's true that the Sûreté du Québec is studying the use of GPS, but we haven't used a GPS so far, and we don't plan short-term to use GPS. So if we decide eventually to use GPS, I want to make sure that we have answers about the protection of personal data.
Okay. And yesterday you said that if families want to take seniors out of seniors' homes, it would be a case-by-case decision. Who makes that decision, and what's the concrete recommendation about that? Should they leave their residences, or will they be allowed to leave?
Okay. But again, the management of the place will have to decide if it puts anybody at risk. So the way the question was asked yesterday, they said the person have to have a certain autonomy in order to go out herself or himself out of the place and then embark in a car and go home. But we have to be careful. There's no question about permitting the family to get into those places.
Time now for questions sent by email. The first one is from Raquel Fletcher, Global News. Before sending the army to northern Quebec, should everyone be tested before deploying to make sure they aren't bringing the virus with them?
Okay, first it's important to mention that those rangers, they are not deployed. They are already on the North Coast. So right now, those people, they don't have any symptoms. They are already there, so we think it makes sense to use them.
As a second question, there are more and more calls for increased testing for healthcare workers, both in public and private sector. Will you change testing protocols so that all health workers who have come into contact with an infected person, whether they show symptoms of the virus or not, be tested?
They are already tested. People who have come into contact with people with COVID-19, the workers are being tested. These are in our new priorities that we've talked about yesterday. So the workers are a top priority in testing.
Okay, so our last questions are from Philippe Autier, Montreal Gazette. Question for Mr. Legault and Mr. McCann. Yesterday, Mrs. McCann. Yesterday, Mr. Legault, you said you could understand some families want to move their mother or father who is in good health from a senior's residence to their home for the duration of crisis. You said, il ne faut pas fermer la porte. Madame McCann said, on se penche là-dessus actuellement. Have you made any further arrangement for this to happen?
Yes, the orientation is clear. The family wants to take the person back in their home. Certainly will be able to do it on the condition, yes, be it in a long-term facility or in residence, private residence, under certain conditions. The Prime Minister has mentioned that the person can go down to the door and people will help her or him with their belongings, and the family comes to the door and picks up the person, so there'll be no contact with the rest of the residents. So this is clear. People will be able to, by arrangement, will be able to go and get the family member. Yeah.
You understood families.
Sorry?
You heard families.
Yes, of course. Yes, and we did this very quickly because we're very sensitive, as the Prime Minister said yesterday. We're all very sensitive to this situation. And, of course, under good protection, it's best for the family member. And if the family wants to do that, take care of their own family member, they'll be able to do it with the proper protection. So we did that. We discussed it very quickly yesterday, and we decided this is the way to go.
Mr. Legault, you want to add something? That's okay. Okay, so last question for Mr. Arruda regarding the growing outbreak in Montreal. What new steps are you taking to protect citizens?
Well, in fact, it's clear that all steps are taken. The one is, I would say, changing on the testing type of persons going to be tested because and continuing to do, I would say, case and investigations around the cases and contacts. There is still that work very done. It's emphasizing the respects of the rules that the Prime Minister says, no people gathering and everything like that. A more coercive approach. Before we want to convince, now we are constrained if needed. And I would say there is also some advices to try to don't travel into those regions if it's not essential, if it's not for work. So that's the case. and we'll also look at the island of Montreal, but I would say all around the 450 region around, which are in strict relationship with Montreal. Most of those approaches that have been taken in Montreal are going to be taken, I would say, in the Couronne Nord, from, I would say, probably Lanaudière, Laurentide, and Outaouais, and in the south. So I think probably the advice is given in Montreal will also be said in Laval and those areas, because it's really a hot spot, I would say, so with some bigger, higher temperature in certain zones. But this region, people must be careful in traveling and respect all the three messages that the Prime Minister says each time.
Well, thank you very much. Merci à vous trois. Ceux qui ont un congé, profitez-en.
Thank you to all three. Those who now have a holiday, enjoy it. Have a good day.